Hello students. Today we will learn about abnormal lung sounds, which are also called adventitous sounds. These are extra or unusual sounds that we hear with a stethoscope, indicating that there may be a problem in the patient's lungs. These are extra or unusual sounds that we hear with a stethoscope, indicating that there may be a problem in the patient's lungs. First, crackles, also known as rales. These are short, intermittent popping or bubbling sounds. They are mostly heard during inhalation, when air passes through fluid-filled alveoli or closed small airways. Crackles can be found in pneumonia, pulmonary edema, or fibrosis. If you hear crackles, it suggests fluid or stiffness in the lungs. Second, wheezes. These are high-pitched musical or squeaky sounds. They are usually heard during exhalation, sometimes during inhalation, and are caused by narrowing or blockage of the airways. They are usually heard during exhalation, sometimes during inhalation, and are caused by narrowing or blockage of the airways. Wheezes are found in asthma, COPD, or bronchospasm. A wheeze means the airway is narrowed, like air passing through a small pipe. Third, rhonchi. These are low-pitched, snoring, or gurgling sounds. They are mostly heard during exhalation, when large airways are filled with mucus or secretions. Rhonchi are found in chronic bronchitis or airway blockage. Rhonchi often clear after coughing as the mucus is moved. Fourth, stridor. This is a loud, harsh, high-pitched crowing sound. It is heard during inhalation, when the upper airway, such as the trachea or larynx, becomes severely narrowed. Stridor occurs in croup, foreign body blockage, or epiglottitis. Stridor is an emergency sound. The patient needs immediate help. Fifth, pleural friction rub. This is a grating, creaking, or rubbing sound like walking on snow. It is heard during both inhalation and exhalation, when the pleura, the lung covering, is inflamed and rubs against itself. Pleural friction rub can occur with pleuritis or infection. If you hear a sound like rubbing leather, think of pleural rub. Summary. Crackles mean fluid or fibrosis. Wheezes mean narrowed airways, like in asthma or COPD. Rhonchi means secretions in large airways. Stridor means upper airway blockage. An emergency. Pleural rub means inflammation of the pleura. Always remember, abnormal lung sounds give us important clues about a patient's respiratory problems. Careful listening helps in early diagnosis and treatment.